very much for joining us tonight at the Schomburg. We have a full night planned, so I'm just going to go straight into asking you a few questions. You've been very open each time you speak about your family struggle with addiction and mental illness. We've heard that your parents struggled with depression. We've heard about your daughter's struggle with anxiety and substance abuse. Mental illness and drug abuse affects hundreds of thousands of people in New York City, and your story has people have really related to your story. So I wanted to start off with my first question, with a question from an audience member. Her name is Edith. She's from the Bronx, and she wrote to us, "Dear First Lady of New York City, when your daughter was first diagnosed, did you blame yourself? How did you react to the diagnosis, and what were your first thoughts and actions?"
Those are 3 questions. And I'll do my best. Of course, I was shocked. I was surprised. I didn't know how to react. And of course, as a parent, you always think, what could I have done? I didn't blame the diagnosis on myself because I knew that this was a condition I had really no control over. But I did wish that I had recognized the signs. Because as a parent, you know that sometimes things aren't right, but Kiara was a high-performing student. She was beloved by her classmates. She was really just like an all-around person. No parent would be upset at how she performed in the classroom and outside of the classroom. But I knew that even given all that, it wasn't right, that something was wrong, that she could even be better, happier, less like a teenager. And that's what I attributed to, that this was a girl who was just from time to time, acting out and being rebellious, just like all teenagers do. And I wish I had known that really wasn't the case. And my advice to any parent is just, if you feel like something isn't right, to trust your instinct and communicate, because I think that usually a parent's instinct is right.
Now, she's written that getting better is one of the hardest things she's had to do. And she also says, I know that fighting my depression, anxiety, and addiction will be a lifelong battle. Mm-hmm. So as a mother, was that difficult to hear? And also, what needs to change in the current mental health system so that she can receive reliable treatment along with many others?
Well, as a mom, I worried. It's just what does that mean? If it's a lifelong journey, that it's. I was diagnosed with asthma when I was in my 30s, and for me, it was a huge transformation. The fact that I had to take medication every day, so that my body would be right, so that I could breathe. It was that serious, right. And so for my daughter. For me to understand, to find out that she was going to have to do things to keep her head straight, right, so that she could function every day, it was a similar shock and transformation. And but I was very happy to know that what she had was treatable, and that was the ray of sun, right, the ray of light at the end of a tunnel. Knowing that it's treatable, that she could have a full life, a happy life. And she's on her way now, so I'm very pleased about that. But we have a long way to go. I mean, it wasn't easy to find the services that she needed, and I feel like if we had one door, I call it the one door to wellness, where when you go to the doctor and your doctor is examining your mind and your body at the same time, we would be so much better off. And we do have some examples, like Mount Sinai, have an adolescent health center that is just fabulous, and that's what happens. You walk in, you're examined by a medical doctor or a social worker, and you get the kind of evaluation and assessment that you need, and that's such a better approach.
Now, you've been all over the city. You've been in all the boroughs. You've visited with senior citizens. You've visited with veterans, with young people, many of them having used the mental health system and sharing their experience with you. What is working and what is not working?
Well, I'm still learning, Cindy. I have been to all 5 boroughs, and what I'm learning is that, well, first of all, there's just still such a huge stigma, and we have to. It's so good what you're doing here tonight, because the more people hear other people's stories, the easier it is to talk about. You know, I often say there was a time when we couldn't say breast and we couldn't say cancer, right? It was just like something you had to talk about in whispers. But the more women stood up and talked about their stories, the more they had a community behind them. And that's what we need to do with mental health, is get people talking. We all have a role to play in this, because everyone knows someone, everyone's affected by it. My understanding is that 1 in 4 people experience mental illness, either personally, or it's a classmate or a colleague or a coworker. That's a lot of people. If we're all those people who had the flu or a broken leg, it would be an epidemic. But because it's invisible, we don't recognize it in the same way. But it needs to have that status, and we need to provide better access. We need places for people to get services where they live. There's just no way a senior, for example, is going to travel an hour on a train to get to a mental health center. I think we only have 2 or 3 in the city that specialize in geriatric mental health service. So we need to do better. And we need more providers. We need culturally competent providers, because there are people who don't. If you speak Cantonese, for example, there may be only 2 or 3 Cantonese psychiatrists available to you. There are not enough Spanish-speaking providers, and this is New York City. We could do better. We could do a lot better than what we're doing.
And so one of the things that I heard you mention at an event recently was this disparity, why so many fewer African Americans receive treatment than whites. Is it the stigma? Is it the access? Is it, do we need to change the way we deliver therapy?
Yeah, I think it's all of that. It's the stigma, for sure. People don't want to, they want to be branded for good reason. We have to really connect mental health and physical health to one another, and to show people that it's normal. It's normal to anxiety, depression, addiction. Those are very common, extremely common in our society. And again, I say 1 in 4 is going to probably experience it, if not themselves, through a friend or someone else they know, a family member. And access, we need to improve the number of places where people can actually go. And maybe not the number, but the places themselves. Maybe it's a clinic that where they could go and get the service. We only have, I think, less than half of our schools have mental health services or health clinics within them. That's something that we could improve.
And do you see that expanding? Do you see school-based clinics expanding?
I would love to see them expanded. I think that is the way we need to go.
When do you think we'll start seeing some results from the roadmap that you've described?
Well, we hope to. We're crunching the data now, and I think that by the end of the summer we'll have a plan, and hope to announce it soon thereafter. But that's not going to stop us from what, actually being out in the field, collecting stories, getting feedback from different groups of professionals, so that we really want to jump in and get working right away.
Thank you very much, Ms. McCray.
Thank you,
appreciate
Cindy.
you being here.